This presentation aims to address the clinical question, does utilization of text messages and SMS reminders result in improved medication adherence? The late Surgeon General C. Everett Koop once said, drugs don't work in patients who don't take them. The statistics speak for themselves. Approximately 50% of medications are not taken as prescribed, and non-adherence is estimated to cost between $100 billion and $200 billion annually. In the U.S., approximately 125,000 deaths and 10% of hospitalizations are due to non-adherence. Forgetting to take medication is often cited as a reason for non-adherence. 4 randomized controlled trials and 1 qualitative study were evaluated. O'BrienNSC et al. Conducted a qualitative study to determine patient and provider perspectives on the use of cellular phone-based technology to improve antiretroviral therapy adherence among patients with HIV. The authors concluded that overall, patients and providers were enthusiastic about the prospect of using text messaging to improve antiretroviral therapy. Park et al. Enrolled patients with coronary heart disease and evaluated medication adherence to statins and antiplatelet medications. Patients were randomized to one of 3 groups. Each group received usual care. One group received text message education plus a text message reminder, and another group received text message education alone. Results were significant among the antiplatelet medication and showed that patients who received the text message reminder had higher percentage of doses taken correctly, and doses taken on schedule. Vervloet et al. Evaluated the use of SMS reminders in type 2 diabetics who were prescribed an oral antidiabetic agent. Participants were randomized to receive SMS reminders or not. Results showed that patients in the SMS group took significantly more doses within the specified time period than those in the non-SMS group. Castaño et al. Studied the use of educational text messages to improve continuation rates among women taking oral contraceptives. At the completion of the trial, patients in the text message group used oral contraceptives more consistently than those who did not receive text messages. Strandbygard et al. Evaluated the utility of daily SMS reminders to improve adherence among asthma patients prescribed an inhaler. Results showed that the absolute difference in adherence rates between the SMS group and control group was 17.8%, which was statistically significant. In each of the randomized clinical trials, primary outcome measures were evaluated and found to be statistically significant. Similarities and differences are present among the trials, yet the use of text messaging and SMS shows great clinical significance despite identified limitations within the publications. The qualitative study supports attitudes and perspectives among patients and providers when evaluating possible use of cell phone-based technology to improve medication adherence. Understanding the findings of the body of literature from the integrative review allows nurse practitioners to implement change based on evidence-based practice. Use of cell phones for text messaging is a widely accepted technology. 90% of Americans have cell phones and 81% send or receive text messages. Using familiar technology that is prevalent among our population makes feasibility of these findings applicable in most any setting or population. The clinical relevance of the findings and utilization of familiar technology makes the utility of these findings very relevant to most any practice, patient type, or geographic location. The literature supports use of text messaging to improve medication adherence, and improved adherence to prescribed therapies should translate to better patient outcomes and a reduced financial burden in healthcare. Implementation of the text messaging intervention would take place in primary care or specialty offices. Upon check-in, patients could opt in to a text messaging program while completing required paperwork for the visit. If patients are prescribed medications or are already taking medications that will be needed for more than 30 days, they would be eligible for enrollment. The patient and nurse practitioner could collaboratively determine which type of message would benefit the patient most, and then determine the frequency with which the message would be delivered. One very attractive feature of a program like this is it would be very inexpensive to implement and would require little manpower to maintain. The potential benefits to patient health are many. I hope you've enjoyed learning more about the use of text messages to improve medication adherence. Maybe one day you'll be implementing this type of program in your own practice.